The state of Michigan is in the process of rolling out a new child welfare technology system. It will replace a more than $200 million system implemented just 7 years ago that has been found to be so flawed it may be putting some of the state's most vulnerable children at risk.
Our number one goal, of course, is to protect the safety and well-being of our children and families that we serve. And we feel like this new information system that we're putting in place will help us do just that.
The state of Michigan is walking away from the child welfare computer system it rolled out 7 years ago. That's because the Michigan Statewide Automated Child Welfare Information System, or MySACWIS for short, has a lot of problems.
So they spent enormous amounts of time, at their computer trying to either figure out where data was being stored or how to make sure that the system was actually getting them what they needed for like CPS investigations.
That meant workers were spending less time in the field, less time on investigations and family assessments, less time making sure kids are safe. Megan Fulkerson is a former case manager with the state. She says there wasn't accurate data in the system when it came to restraints, parent visits, and visits from brothers and sisters.
A lot of those things were not getting put in correctly, or might be putting in much later time, things like that. And especially for the youth that we dealt with that were basically on probation or general residential, I mean, those documents go to court. That has a big part in where the rest of their treatment's going to go, wherein they're allowed to be home.
She also says the system caused a lot of disconnect between facilities and their workers. She says a lot of workers didn't have an accurate picture of where clients were in terms of their treatment or care.
So for a worker, if you place a child somewhere, I mean, you do heavily rely on something like that to see the reports and see what's going on. And if those things aren't being uploaded or aren't going through, then it creates that huge gap. So we ran into that a lot. I mean, it just really wasn't up to date for, where we were in the times. It would have just a lot of side issues. I mean, you couldn't get through like certain reports if you were missing something. It was kind of all over the place.
In 2019, an independent report to assess the system was released. It found that the system had what a consultant called an unmanageable backlog of defects, incidents, and data fixes that are likely to persist indefinitely, getting in the way of effective casework and potentially hurting children and families.
Despite a lot of effort from state folks to try to address these issues as they arose, the rollout of the MySACWIS system was really plagued with issues from the start. The state repeatedly tried to address issues as they arose, but just did not seem to be able to get a handle on that system in terms of usability for the social work staff, and then the accuracy of the data that's actually contained in that system.
Here's a little backstory on how the system came to be. The Michigan Statewide Automated Welfare Information System was rolled out in 2014, following a lawsuit in 2006.
So the Duane v. lawsuit was filed, back in 2006 now. We brought the lawsuit back in 2006 as a result of a number of serious and dangerous deficiencies in the state's foster care system at the time.
Elizabeth Grutter is an attorney with Children's Rights, the nonprofit organization behind the suit. She says those deficiencies included things like maltreatment and neglect of children in the state foster care system by their caregivers.
Children bouncing from placement to placement over and over again, children not receiving the medical and mental health services that they needed, not receiving visits from their caseworkers. There were a number of concerns that were leading to children not being safe in Michigan's foster care system. We settled that case with the state of Michigan for the first time in 2008. So the parties reached a settlement, agreed to a number of reforms to the system. One of those reforms was the rollout of a new and improved data system.
But Grutter says the system couldn't even provide clarity on a basic question.
In that original settlement, one of the key issues that we wanted the state to address was to be able to actually count how many children are abused or neglected while they are in Michigan's foster care custody. That is a critical piece of information. And when the system first rolled out, the state did not have a handle on that number. And as a result of a number of the data issues over the past couple years, and as you've probably seen in some of these federal monitoring reports, that continues to be an issue.
Now fast forward to 2021. The State Health Department is putting in work to make these improvements. The new system is called the Comprehensive Child Welfare Information System, or CWIS for short.
Our system, we believe, is going to allow us to take that significant next step in the department's effort to overhaul our technology and to better serve our children and families by providing reliable data to track our performance and also track different modules for our staff to input data when it comes to CPS staff, foster care staff, adoption, juvenile justice, and licensing staff.
The new system will have a price tag of more than $49 million and should be in place by 2025.
We have a lot of confidence in this new management team and in the rollout of the new system. And we have a lot of optimism that in the coming monitors report and in the coming years, we're going to see a real improvement in the quality of the data, not only as it relates to maltreatment, but to the safety of children in foster care generally.
Reporting in Lansing for Fox 47 News, I'm Tiana Jenkins.